So we're going to do heart and lungs, and then also circulation in your extremities. So the first thing I want to notice is I'm paying attention to whether you're breathing comfortably or you're breathing fast and labored. And so I can tell right off you're relaxed, you're breathing comfortably, it's not a problem. And if I want to actually check for excursion, probably what I'm going to do is, let me let you scooch around a little so I can demonstrate this a little better. Probably the easiest way to check for excursion and tenderness is to go on and put my hands on your lateral thorax and ask you to take a big, full, deep breath. Then okay, now let it out. I can see my hands moving quite well. I see good excursion. And is anything here tender as I'm touching? Okay, okay. Now I'm ready to listen. Let me do, and I'll just let you stay right here, and then I'll have you scooch around for the front. What I want to do is listen to the 4 lobes in the back, the 2 upper and the 2 lower. What I want you to do is every time my stethoscope touches your back, I want you to take a big, full, deep breath in and out, just kind of slowly in and out. So there'll only be 4 places.
Okay.
So I'm on the skin right up here, so go on and breathe for me. Good, let it out. Perfect. Do that again. All right, very good. Now I'm going to go down here and get underneath the material. I have to do the same thing. Perfect. And once more. Okay. Now if you'll turn around to this way, I want to show where I want to listen. If there's one place in front I listen because that's where the right middle lobe is. So I may let you hold your right breast up just a little because I'm going to get right here in front. And again, have you take a big, full, deep breath. Okay, good. That's it. So everything sounds fine. That is clear. Now I want to listen to your heart. Now, you don't have to breathe deeply for your heart. Just be relaxed. And I'm going to listen quite a few places where your heart's hear the rhythm and over the valves. And then I'm going to listen to 2 places under your left breast that I'll let you help me with when we get there. I'm also going to feel one place. So I'm going to listen and feel at the mitral valve as well. So just relax and breathe normally. And let me start with listening to your heart in the middle here. So. Okay, then I'm going to go over each valve. Now if you hold your left breast up for me, I'm going to listen right by your sternum. And then I'm going to listen a little bit over here. And in just those 2 places, I'm also going to turn this over and listen with the other side of the stethoscope for a different frequency. Okay, one here. Okay, good. Now the last thing I'm going to do is, if you'll lean forward just a little, I'm going to put my hand in the same spot. At this point I'm trying to feel if I can feel the heartbeat, because it should be either not existent or very weak, because it only gets strong if it's enlarged. So that's good. That's all I need. Great. Now the last thing we're doing is the peripheral vascular exam. So when I'm going to do both upper and lower extremities. We can simulate as though we could see all the lower extremity, because part of it's visual. But I'm really, first of all, I'm looking for, are the extremities equal in size? Is there any asymmetry? And then from a color standpoint, is there any change in color? And then I'm also interested in temperature. There's various vascular problems that could change temperature, so I'm going to feel for temperature. And then for lower extremity, probably, well, and while I'm here, I'm also going to check the pulse in your upper extremity. So I'm going to check both radial pulses to see that they're full, and they are. We have a number system for that. And then for lower extremity, and normally you wouldn't have, you'd have shorts on. I'm doing the same thing. I'm looking for symmetry. I'm looking for color change. And particularly for lower extremity, I would be looking for edema. Now, edema means you're collecting a little fluid and staying in there. So typically what I'm doing for edema is I'm pressing probably over the shin or the top of the foot to see if I have any indentation of my hand and where the edema was going to stay there. So in your case, we're simulating that just a little, but I think that works well. So.
Right.
Okay, good heart lungs. So let me reinforce the steps. In order to see whether you're breathing comfortably, I have to make a conscious decision of watching whether you look like you're in labor or not. And if you were breathing fast, I could tell, or sometimes I can tell it by what we call the accessory muscles of inspiration, where I could see extra muscles working for you to breathing. For breathing, I didn't see that. The next thing is you'll notice that when I put my hands on your ribs, if I want to see how well your ribs are moving, it's just much easier for me to get my hands there and watch my hands move, and then at the same time when I've got my hands on there, I can also ask you, was anything tender? So we kind of get those two things taken care of. The next thing is, and you did good when you took a good deep breath every time I put my stethoscope on your chest. And I need to listen what we call through a full respiratory cycle, so you actually breathe all the way in and all the way out. So I can't do that very fast. I have to make sure you have a full breathing cycle. And what I see students doing is I see them not getting low enough in the back. They listen up here pretty well, but the lower lobes are actually quite low. So I see students kind of listen in the mid back. I want you to make sure that they go that they go.
Turn.
No, you're fine. You're
Show
fine.
me.
But they need to go all the way down. So in fact, you'll notice what I don't like to see is I often see a student listen here, and then they'll go right here. Well, that's too mid-level. That's not far. That's kind of where the fissure is between the upper and the lower lobe. So I want them to be quite a bit below the scapula. I want them to be down in here and listen in the lower areas. And then on the middle lobe, there's some debate from some sources about whether you're going to hear the middle lobe best in the front or the side. But this middle lobe actually changes about right here. So the right middle lobe, I really want them to be in front, right below there. The issue on the heart too is we've changed this from last year. The students know they have to listen with both the bell and the diaphragm because the diaphragm picks up low-pitched sounds. What we've changed is the two valves up here don't have any low-pitched sounds, so they really don't have to listen for anything other than the diaphragm. I listen in the middle first, and that's for the rate and rhythm. Then over these two valves with just the diaphragm. When I got to the tricuspid and the mitral area, you'll notice that I listen with both sides individually, because the bell will pick up things like S3s and S4s that only are heard down there and can only be heard with the bell. And then the PMI, again the PMI, the students struggle with this because the PMI is the point of maximum impulse of the heart, and it's normally very subtle or not felt at all. And it's only abnormal if it's really strong. So it's like we're feeling it, it's like, well, they're disappointed I didn't feel much. No, you're not disappointed. That's what you should expect. And then of course with extremities, the only thing that I neglected to do on extremities, so let me reinforce it, is I checked your pulse here when I did the lower or upper. When I'm at the lower extremity, there's a posterior tibial pulse that's just behind the medial malleolus right here. So I need to check that pulse as well. So I'm checking for general extremity and pulsal. So that's the only thing I need to add.